My name is Omwath Peter. I coordinate non-communicable diseases for Siaya County. Non-communicable diseases include diseases like hypertension, diabetes, the cancers, sickle cell disease, mental health, asthma, and other NCDs. I'm saying county governments, we are now very focused to look at non-communicable diseases because we have realized that it is the second cause of morbidity and mortality after the communicable diseases. After diseases like malaria, HIV, diabetes, non-communicable diseases is the second most important cause of mortality and morbidity. And we must give it the attention it deserves, more importantly in prevention. And I want to say 50% of our inpatients are actually due to non-communicable diseases. So prevention on non-communicable diseases would be extremely important. Another thing I'm saying is that 39% of deaths in the hospitals are due to non-communicable diseases. If we don't address this, by the year 2030, it can be a disaster. It is projected that it might go up to 47%.
The biggest burden we have in Siaya is that we know patients have cardiovascular disease, if I talk about that specifically, and also NCDs. And this includes things like, as you said, mental health and malignancy. If you mentioned the ones which are non-cardiovascular. So that's malignancy and mental health. And then there's asthma and the respiratory illnesses. Okay, but now if we focus on cardiovascular disease, we don't know the burden, and that's one of our problems. A lot of data, and this is what the program is trying to find out. We don't know the burden of this disease in our patients, especially those with HIV and those even without HIV. We know the country burden through estimates, but even if you look at hypertension, more than 50% of patients are unaware that they have hypertension. They are walking around, they hardly have symptoms, and they are not screened at hospitals, even when they go for common illnesses like cough, diarrhea, and so on and so forth. Even our patients with cholera, the first thing you don't think about is, what do you think about? You manage the diarrhea. You don't even think about, do they have a cardiovascular problem? So that's one of the things we need to change.